All right, well, open enrollment, it's a time of year, and it certainly can be stressful for a lot of people.
Yeah, there are so many choices when it comes to healthcare coverage, but we are here to help. Joining us now is Gina Breton from Access Health Connecticut.
Welcome.
Hi. This is kind of, we got the emails yesterday from our corporation. You know, Karen and I are covered by the Meredith Corporation, but, and I freaked out. I was like, I saw it. They're like, you got to start making choices. You got to start doing this. But your company is here to help.
We are. And so Access Health Connecticut really just wants to make sure every individual, family, and small business in our state has access to affordable, quality health insurance plans from brand name companies. And so if you're not offered insurance through your employer or through a spouse or otherwise, open enrollment is coming, and it starts November 1st. And that's when you can visit accesshealthct.com and check your options, because you might even qualify for financial help. And that is really important for people to remember.
Absolutely.
And as much as there's been talk about political changes, it's still the law of the land that everyone needs to be covered.
They do. And while there's not a penalty necessarily anymore for not having coverage, it can really protect your personal finances, because you can never be sure of when you're going to need health care. And, you know, it's also really great for those preventative care services, you know, to make sure that you're getting checked each and every year and getting screened, because early detection is key. And those preventative benefits are included in all plans through Access Health Connecticut.
What questions should people be asking, you know, when they come to you? I would become clueless.
Sure. So it's the first question, especially if you're a customer, is your plan working for you? Are your doctors in network? Are you expecting anything major to happen in the next year? Do you need a new hip? Are you expecting a planned surgery? Because you might want to look at your coverage, and while, you know, that monthly premium payment is really attractive at a low cost, if you have services or a specialist that you see monthly, you might want to increase that benefit so it's covering more before you have to go and get those services. And so you can visit our site, accesshealthct.com, and there's a button, compare plans, and it will take you through if you have a doctor you need to make sure that's in a network. And it's going to show you financial help that you may qualify for based on your estimated income. And you can kind of start to filter those plans looking at the questions that you're asking yourself for the coverage you've had the previous year.
Okay.
And I know the website is so interactive, but if you're old-fashioned or you just need help, there is also a call line, and you have people who speak different languages who can really walk you through it.
Of course, because healthcare is a really personal decision, and so we want to make sure people are comfortable speaking in the language that is best for them.
Well, a lot can be lost in translation.
Listen, and you know, no pun intended, because it is very true, and we find that having a call center that has access to over 100 different language services and translation services is really important, because there are a lot of languages spoken here in Connecticut.
And there's still a deadline. I mean, you have to do it during the right time or you're going to miss out, right?
Sure. So open enrollment is November 1st through December 15th. And so that is really important, because that is when you can come and shop, compare, and enroll in healthcare plans. There is also a special enrollment. So if you have a life change throughout the year, you can always visit our site and find out if you qualify for a special enrollment. So if you have a job that no longer offers you coverage, or you're pregnant, or you lose your coverage for all these other different reasons, it can qualify you to come in throughout the year. So it's always best to check our site and talk to someone in our call center if that's how you're more comfortable.
All right, Gina, thank you so much. There's the website, accesshealthct.com.